Did you know that more than 1 in 5 US adults experience mental illness every year? That's nearly 54 million people seeking support, treatment, and care. As awareness around mental health continues to grow, behavioral health providers are helping more patients than ever before. But while the focus should be on delivering quality care, many providers find themselves spending just as much time dealing with the administrative tasks. One of the biggest challenges, billing. Behavioral health billing is often far more complicated than people realize. That's where behavioral health billing software comes in handy. Today, we're going to talk about what it is, why mental health billing is so complex, and how the right technology can help practices improve both efficiency and financial performance. Behavioral health billing software is designed specifically for mental health and psychiatric providers. It helps organizations manage things like insurance claims, patient payments, coding, reimbursement tracking, documentation, and other billing-related tasks. Unlike general medical billing solutions, behavioral health software is built around the unique needs of mental health providers. Many patients receive recurring services over long periods of time, which means providers need to keep track of ongoing treatment plans, authorizations, documentation, and payer requirements differently. Without the right tools, that can become overwhelming. And that's because healthcare billing comes with a unique set of challenges. Every payer has different requirements. Medicare, Medicaid, and commercial insurance plans all have their own rules. Providers need to accurately document medical necessity, assign correct CPT codes, verify eligibility, and ensure services meet payer guidelines. Even a small mistake can create problems. For many providers, especially those running smaller practices, the challenge is even greater because they're not just acting as clinicians, they're also handling many of the administrative and billing responsibilities themselves. That's a lot to manage. This is one of the biggest reasons organizations invest in healthcare billing software. The right solution helps reduce manual work and creates a more efficient billing process from start to finish. One of the biggest advantages is automation. Modern billing platforms can automate tasks like eligibility verification, appointment reminders, claim tracking, payment posting, and patient statements. Instead of spending hours on repetitive administrative work, staff can focus their time on higher value activities. Many platforms also include claim scrubbing technology. Claim scrubbing reviews claims before they're submitted and identifies potential errors that could lead to denials. By catching problems early, providers can improve claim accuracy and get paid faster. Integrated billing software can also help improve visibility across the entire revenue cycle. When documentation, coding, and billing all work together in one system, organizations have a much easier time identifying issues before they become costly problems. And the benefits aren't limited to providers. Patients benefit too. Features like online payment portals, automated reminders, digital forms, and flexible payment options make it easier for patients to stay engaged and manage their financial responsibilities. So, what should organizations look for when evaluating behavioral health billing software? First, look for a solution that integrates with your electronic health record system. Connecting clinical and financial workflows can help eliminate duplicate data entry and improve claim accuracy. Second, make sure the platform is HIPAA compliant and includes strong security measures to protect patient information. You also want practice management tools that support scheduling recurring appointments and digital intake forms. And finally, prioritize automation features that help reduce manual work, improve collections, and streamline claim management. At the end of the day, choosing the right behavioral health billing software isn't just about improving billing. It's about creating a more efficient organization that allows providers to focus on what matters most, helping patients. If you'd like to learn more about behavioral health billing software, reach out to Etactics, and you already made it this far into the video, so you might as well like it, share it, and comment below.